You've probably heard about unusual food cravings as one of the most common pregnancy symptoms, but there are a number of weirder symptoms than a hankering for pickles dipped in peanut butter. Although weird pregnancy symptoms can be alarming, in most cases, they are a normal part of expectancy and not cause for concern. Let's check out the top 10 unusual pregnancy conditions and symptoms. Before starting the video, please subscribe to the channel and click on the notification icon so you'll get notified when we upload the next video. 10. Superhuman sense of smell. The nose knows, especially when you're pregnant. Here's how to cope when your heightened sense of smell during pregnancy sends you running for the hills or the bathroom. Can you tell what's on the menu before you've even entered the restaurant? Does the smell of deli sandwiches turn your stomach? Studies suggest that as many as 2/3 of pregnant women become more sensitive and reactive to the scents around them when they are pregnant. Just another one of those strange early symptoms of pregnancy. It may sound exaggerated, but some women are shocked at how sensitive their sense of smell becomes. All of a sudden, the assault of odours you pick up from the most mundane items may cause you to feel alien in your own skin. Or worse, nauseated. As many as 2/3 of pregnant women experience hypersomnia, which is caused by pregnancy hormones like estrogen. Keeping a small handkerchief handy with a drop of your favourite essential oil for sniffing is a good way to distract the nose with a more pleasant scent. It typically goes away after the first trimester. 9. Heartburn and gas. Heartburn, despite its name, has nothing to do with the heart. It's a burning feeling in the throat and chest when the stomach's contents move back up into the esophagus, the tube that moves the food from the throat to the stomach. Heartburn is common during pregnancy. Pregnancy hormones can make the valve at the entrance to the stomach relax so that it doesn't close as it should. This lets acidic stomach contents move up into the esophagus, a condition known as gastroesophageal reflux, GER, or acid reflux. It can get worse later in pregnancy when the growing uterus presses up on the stomach. Some expecting parents aren't too pleased with feeling like a belching trucker after a round of spicy enchiladas. As uncomfortable as the symptoms may be, Stanford Children's Health says digestive issues are perfectly normal. Even the blandest of foods may cause the issue. If it's any consolation, over half of all pregnant people experience heartburn. Pregnancy hormones can throw your digestion off balance and cause the esophagus to relax, creating acid reflux. Talk to your healthcare provider about whether antacids are safe to take. 8. Spotting. For most people with a uterus who want to avoid pregnancy, periods and spotting are typically signs that there's no baby on board. However, spotting can occur when you're pregnant, leaving you confused about whether you're actually expecting or if something is wrong. False periods during pregnancy happen to 25% to 40% of women. The best way to determine if spotting is serious or ordinary is by monitoring your discharge. If bleeding becomes bright red or heavy, or you experience cramping or stabbing pains, contact your healthcare provider right away. Bleeding during pregnancy is common, especially during the first trimester, and usually it's no cause for alarm. But because bleeding can sometimes be a sign of something serious, it's important to know the possible causes and get checked out by your doctor to make sure you and your baby are healthy. About 20% of women have some bleeding during the first 12 weeks of pregnancy. 7. Nosebleeds and bleeding gums. You may feel more fragile than normal during pregnancy, experiencing nosebleeds and bleeding swollen gums. Believe it or not, this may also be a normal part of pregnancy. Making a baby isn't easy. Your body's blood volume increases dramatically during pregnancy, up to double. The increased blood flow to more sensitive tissue such as gums and nasal membranes may cause bleeding. Hang in there, it shall pass. Nosebleeds are quite common in pregnancy because of hormonal changes. They can be frightening, but there's nothing to worry about as long as you don't lose a lot of blood, and they can often be treated at home. During a nosebleed, blood flows from one or both nostrils. It can be heavy or light and last from a few seconds to more than 10 minutes. Nosebleeds can happen when you're asleep. You might feel liquid in the back of your throat before blood comes out of your nose if you're lying down. During pregnancy, you may also find that your nose gets more blocked up than usual. 6. You are extra stretchy. If you practice yoga or exercise before and during pregnancy, you may discover newfound flexibility you never imagined. It's only temporary. Your body's preparing for childbirth, so enjoy touching your toes while you can. A hormone aptly named relaxin will start releasing, preparing your pelvis to expand by the time you're ready to birth. All that flexibility can be uncomfortable too. Your pelvis and surrounding ligaments may shift more easily, especially while you sleep, causing soreness and pelvic pain. 5. You develop stripes and spots. Well, not really, but you may notice a darker line from your belly button down. It's called the linea nigra, and it was always there. It's just darker and more obvious when you're pregnant. It's not the only thing that darkens. Some pregnant people experience other forms of hyperpigmentation, such as melasma, face spots, and darker nipples. No need to worry, it's common and benign. A dark line down your stomach or a dark patch on your face might seem weird, but it's no cause for concern. 4. Brain fog. It's real. Another one of the many weird pregnancy symptoms is a level of forgetfulness, sometimes known as pregnancy brain. You may feel more forgetful or distracted, having trouble focusing as you used to. It may be caused by hormonal changes and even from an interruption in your regular sleep patterns. While some may question whether mummy brain is real, over a dozen studies have been done, and they all agree that pregnant people do experience cognitive decline during and after pregnancy. At some point during pregnancy, you may find yourself feeling like your little bundle of joy has hijacked not only your body, but also your mind. Lost keys, forgotten appointments, and misplaced wallets are just a few symptoms of this common mental fog. There is a great deal of research on the impact of a parent's physical health on fetal development. But because pregnancy is a period marked by massive changes in the body, including dramatic hormonal shifts, psychologists have become interested in learning more about how pregnancy affects parents mentally as well. Studies suggest that pregnancy does indeed have an impact on the brain. Some researchers believe that these brain changes help make expectant parents better prepared for the rigours of caring for a newborn. For example, by improving their abilities to cope with stress while being more attuned to their infant's needs. While pregnancy brain might lead to bouts of feeling forgetful, the upside is that these shifts can lead to more sensitive and responsive parents. 3. Acne. An increase in acne and other skin changes can also be a pregnancy symptom. Be careful what medications you use to treat it though. Some medications like Accutane and those that are high in vitamin A can cause birth defects. It's best to talk to your doctor about how to battle bad skin while you're pregnant. Acne tends to rear its ugly head again during pregnancy due to hormonal changes. While pregnancy glow is often mentioned, far too many people glow less and break out more. There's not much you can do if you're dealing with acne other than riding it out, using oil-free products and gentle cleansers. Using acne medication or retinoids, which are usually effective against acne, are not recommended for use during pregnancy. 2. Metallic taste. Some women experience a strange taste in their mouth, typically metallic. Known as dysgeusia, symptoms usually flare up because of the hormonal changes that happen during pregnancy. There may be other reasons behind why there is a metallic taste in your mouth. Your gums may be bleeding or vomiting from morning sickness, maybe throwing off your breath. Next time the unusual flavour appears, consider brushing your teeth with peppermint toothpaste, drinking mint tea, or chewing on flavoured gum or breath mints. 1. Stuffy nose. Nope, you're not allergic to being pregnant, you're simply congested or feeling stuffy. Known as pregnancy rhinitis, the chronic stuffy nose you're experiencing during your pregnancy is caused by swollen mucous membranes and enlarged nasal veins. Your nose is so far away from your uterus, how could it be involved? But nosebleeds and stuffiness are very common due to an increase in the blood flow through your nose during pregnancy. In fact, the prevalence of nosebleeds is 20.3% in pregnancy compared with 6.2% in non-pregnant people. You can treat the symptoms with natural remedies, like using a humidifier or using a neti pot to rinse your nasal passage with salt water. If that doesn't help, talk to a doctor or midwife for other options. Rest assured that aside from being inconvenient, nosebleeds and stuffiness during pregnancy are rarely severe. Although congestion can be uncomfortable, avoid over-the-counter medications, which can do more harm than good when you're pregnant. The best ways to get relief include sniffing citrus or mint essential oils, adding a humidifier to your space, or drinking more fluids. Do let us know in the comments which of these symptoms you had in your pregnancy. Thanks for watching.